56-year-old female, incidental intracranial aneurysm. We have here her ICA, right ICA angiography, AP view. So we have this right internal carotid artery, M1, right A1. This is right A2, and the aneurysm is projecting downwards apparently, forward and mainly downwards. And you can see that the aneurysm is almost on, at least on the lateral projection, the aneurysm is almost touching. Obviously, it's not touching the dorsal, the superior aspect of the ICA, but at least on the lateral projection, it is. So it implies that the aneurysm might be attached to the optic chiasm or a little bit downwards. We all know that carotid artery is lower than the optic nerve and lower than the chiasm, but the A1 is above the optic chiasm. So if on the lateral projection, the dome is kissing the superior aspect of the supraclinoid ICA, that implies this aneurysm might be attached to the chiasm or even lower, stays in between the two optic nerves. Obviously, depends on whether if the chiasm is prefixed, is normal fixed or post fixed. And also on the, well, we know this is right A1, right A2. I'm not sure about where the A1 on the left side is located. Then this must be A2, but I need more detailed image to talk about this. So here we have the on the left a reconstruction of the right ICA oblique view. This is supraclinoid ICA, M1, A1, and then this is A2 on the right side. This is aneurysm. We already know that. But on the left side, we can see that probably this is A2 going up. So this is probably A1. So they join in a common trunk. Probably this is what we call the ACom. And then the aneurysm. So we know that there's nothing, no important vessel anterior to the neck. And then we see this is a superior view from top down. This is a supraclinoid. This is a right A1. This is right M1. We can see that this A1 and then this is a right A2. And then this is that common trunk. Probably A1 and this is A2 on the left side. So the aneurysm is free, projecting freely anteriorly and inferiorly. So this patient underwent a right terional approach to have her aneurysm clipped. So let's see the video. So he's opening the very proximal part of the sylvian fissure, almost very close to the carotid cistern instead of opening the sylvian fissure up here. That's okay. A sharp dissection, as always, using knives and mainly the scissors. He's using scissor. This is an unruptured aneurysm, so cisterns are very generous, very good. So proceeding, this is right frontal lobe, right temporal lobe. So be very careful when you're approaching the, not at this stage, but when you're approaching the optic nerve, you be careful because aneurysm will be projected inferiorly and probably it will be attached to the optic chiasm and maybe stays in between the two optic nerves. So we always have this frontal orbital vein crossing the sylvian fissure. See, we always have this. And this is carotid artery, supraclinoid segment of the ICA. Now he's trying to dissect that frontal orbital vein. It ruptured, so he'll have to coagulate and cut. Actually, he has to do this because otherwise there's no way to, if you want to retract the frontal lobe backwards. Now that frontal orbital vein has been cut. Now this is internal carotid artery opening the arachnoid of the carotid cistern. Now he's moving towards the right optic nerve. It's right here. Very careful in this area because the dome of the aneurysm might be around here. So sharp dissection. You can use dissector if you want, but he's using scissors. So this is the right optic nerve, right internal carotid artery, supraclinoid segment. Now you can see a little bit of probably aneurysm over here. So he's continuing to open the arachnoid. So you see the aneurysm is not only attached to the optic chiasm, but it also is projecting in between the two optic nerves. So he's continuing to open towards the left side. This is aneurysm. So for this kind of aneurysm, you don't have to resect the rectus gyrus to expose it. So see, this is in between the two optic nerves. Maybe here is optic chiasm. So he's dissecting the undersurface of the aneurysm. Now he's trying to detach the dome of the aneurysm from the optic chiasm or optic nerve. Here will be the lamina terminalis. And you don't do this if the aneurysm has the very thin wall, very red wall. But you can see that the wall of this aneurysm and ruptured aneurysm is not that thin. So if you have a good skill, good experience, you can do what he's doing right now. He's dissecting the dome from the optic nerve. So as we saw on angiogram, this A1 and this is A2 from the right side, and also on the other side, the A1 will join A2 and then form the ACom, and then everything's going backwards. So now he's checking the left side. What's going on the left side? Where are the A1? Where is the A2? Here is probably the A1. It's lifting. Now he's looking from above. If he can see the A1, it's dissecting retracting the aneurysm to see here the A1 here. This is left optic nerve. You can see the A1 here. Because he already knows where the location of the A1 is, where the location of the right A1, A2, and now he's clipping the aneurysm. So this is the contralateral. That one is contralateral, the left A1. Clipping the aneurysm slowly. And then you have to check if there anything else involved has been clipped. So maybe he has to pull back a little bit of the clip. Yes, to make the A1 contralateral A1 free. He has done that. And now the contralateral A1 it's okay. The next step, he's going to puncture the aneurysm. This is exactly what he's doing now. And it's gone. It's coagulating. The aneurysm. Then this is A2 going backwards. On the left side, it will be the same. So this is the final aspect of the surgery. And she remained neurologically intact after the surgery.